Hi everyone! Today we're going to put your skills to the test and complete a full OET mock test. Whether you're aiming for registration in the UK, Australia, or the USA, this session is designed to simulate the test day. Today you'll have a chance to try all 4 tasks yourself. After each section, we will review sample responses against the official scoring criteria, showing you what went well and what can be improved. Stick around to the end to see what your score will be for the entire mock test, which you can complete now in real time. Before we start today's mock test, I recommend you download the answer booklet. With this booklet, you'll be able to work alongside this video for each task. For extra practice after this video, there are additional prompts included. To ensure you receive all future OET videos and exclusive tips, like and subscribe while you wait for your booklet to download. If you want to complete a full graded mock test or individual speaking or writing assessments, you can at e2language.com. There you will receive your results and feedback from an expert examiner who will show you all the ways you can improve your exam results on test day. So, are you ready to tackle a full mock test? Well, of course you are. So let's begin. Just like on test day, let's start with the listening subsection. The listening subtest consists of 42 questions in total. To achieve a grade B, in other words, a score of 350, you typically need to get at least 30 marks correct. The test takes about 40 minutes and is divided into 3 parts, featuring a range of accents from around the global healthcare world. Part A consists of 2 consultation extracts, which are about 5 minutes each. You'll hear a health professional talking to a patient, and your task is to complete the case notes with the exact words you hear. Part B moves to the workplace. You'll hear 6 short extracts, usually something like team briefings or handovers, and those last about a minute each. Here, you'll answer 1 multiple choice question per extract to identify specific details or the gist of the conversation. Finally, Part C tests your ability to follow longer presentations or interviews on healthcare topics. You'll hear 2 5-minute recordings and answer 6 multiple choice questions for each, focusing on the speaker's attitude, opinion, and main ideas. Remember, you only hear the audio once. Spelling and grammar count, so stay sharp. Before starting the mock test, let's go over some tips and tricks. The format is that there are 2 extracts. There are 24 questions in total, and it's a note completion task. You have approximately 5 minutes per extract. In Part A, you'll hear 2 different consultations between a health professional and a patient. Your task is to complete the case notes using the information you hear. Now, here is the golden rule for Part A. Write exactly what you hear. If the patient says, "I have a throbbing pain," but you write pulsating pain, you'll likely score a 0. You must use the exact words from the recording. Before the audio starts, you have 30 seconds to look at the notes. This is not break time. This is prediction time. So let's talk about strategies. The first strategy is to predict the gap. Look at the gaps and predict what kind of information is missing. Is it a number, a body part, a symptom? For example, if the note says suffers from blank, then you know you're listening for a condition. If it says duration blank, you're going to be listening for a time period, such as 2 weeks or 6 months. Now, the second strategy is to use the signposts. The notes on your page follow the order of the audio. Use headings like medical history or current diet as signposts. If you get lost, look for the next heading to find your place again. Now, the mock test for Part A. Are you ready? We're going to do 2 full extracts. You're about to hear a dietitian talking to a patient named Kylie Hogan. You have 30 seconds to read the notes. We'll put the timer on now.
Extract 1, questions 1 to 12. You hear a dietitian talking to a patient named Kylie Hogan. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at your notes.
Kylie Hogan?
Yes?
Nice to meet you. Please come in and have a seat.
Thank you.
I have your referral here from your GP, but would you mind telling me more about why you've come to see me today?
Well, I've been struggling with my weight now for, it seems like forever. Ever since puberty, really. I just haven't been able to shift it. After my second child, I was left with a lot of loose excess skin, so I went to see my GP about having a tummy tuck. She gave me all the details of what to expect, long healing process, scarring, and I must admit it scared me a little. But I'm still considering it down the line. She said I'd need to get close to my ideal weight and keep it stable for at least 6 months before the surgeon will consider operating on me. So that's my goal now. She also said that a lot of people consider surgery after losing the weight, as long as they can maintain it.
Okay, and do you have an idea of what your ideal weight should be?
To be honest, I don't. I'm only 160 centimetres tall and I'm about 85 kilos. I know that's considered quite overweight, but as I've said, I've struggled with it for a long time.
Can you tell me what your diet was like when you were growing up?
My parents owned a fish and chip shop and they worked very long hours. Everything was deep fried in oil and always covered in salt. I'd usually eat at least one meal every day there. When we did eat at home together, my parents usually cooked lots of pasta, spaghetti, pizza, that type of thing. Every dinner had a dessert, usually cake and ice cream. I'd always have a second helping, and that was 7 nights a week. There was very little in the way of vegetables, and if they were included, I was never made to eat them. The only fruit I can remember enjoying was watermelon in the summer.
And how about these days?
I've learned a lot from my parents' mistakes. I make sure my kids have a lot of fruit and vegetables, lean meat, that type of thing. I try to eat the same, but once the kids are asleep, I find myself indulging in desserts and fizzy drinks. I typically get 1, sometimes 2 slices of pizza for lunch when I'm at work. I like a bit of comfort food every night when I'm watching TV, like crisps and chocolate. They also go nicely with a nightcap.
And how is your alcohol intake?
I don't really drink a lot, if I'm honest. Maybe 2 or 3 standard drinks a night. I like really milky alcohol, cream liqueurs, that type of thing.
Okay. And do you have any chronic illnesses, diabetes, anything like that?
No, I don't have diabetes, although my GP says I'm a prime candidate. My cholesterol is high, but I can never remember the exact levels. I'm sorry. My blood pressure is quite high as well. I have a CT angiogram booked for next week, and I have to admit, I'm more than a little nervous. What else? When I was a kid, I was allergic to soy. I think I've outgrown it now, but I still avoid it. I just loathe the taste. During my early 20s, I went through a stage there when I'd just bring back up every meal. The doctor said I had bulimia, but I disagreed at the time. I just wanted to lose weight quickly, and it didn't last long, no more than a couple of months. I know now that it was a stupid thing to do, but I was young and naive. I had postnatal depression after my last delivery, but again, it didn't last long, maybe 3 days. Other than that, I'm pretty healthy. It's really just my weight that I'm concerned about.
Okay. Well, I'm very happy you came to see me because the first step to weight loss is making a decision to change some of the...
Great! How did you do? Okay, now let's move immediately on to extract 2. This time you'll hear a GP talking to a new patient named Frederick Smithers. You have 30 seconds to read the notes. We'll start the timer now.
Extract 2, questions 13 to 24. You hear a GP talking to a new patient named Frederick Smithers. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at your notes.
Hi, Frederick. I'm Dr. Heath.
Hi,
Now, you were last seen by Dr. Belfield, is that right?
that's right, yes.
Well, let's start with what brought you here today.
It's a number of things, actually, all related, but, well, it's a little embarrassing.
Take your time.
I've been having a lot of excess gas these days. It's been going on for a whole week, actually. I'm not sure what's happening, but I've started getting this knotted feeling in my lower belly, too. At first, I thought I'd eaten something that may have gone bad, but then I noticed a few other things that made me immediately turn on my computer to check the symptoms. You see, I've been having pretty bad diarrhea, and quite often, up to 5 or 6 times a day. It's really uncomfortable. I'm still working, which makes things difficult. I work in a small office, and I'm sure my co-workers have heard the loud rumbling noises coming from my gut. They haven't said anything, but I get some rather concerned looks from time to time. Now, I've even noticed that my belly looks quite swollen.
I see. You mentioned you first thought it could have been something you'd eaten. Can you tell me what you eat on a typical day?
Well, I eat a healthy diet. For breakfast, I have a range of high-fiber cereals. I do eat between brekkie and lunch most days, especially if I'm working, but it's all healthy food. I stick to snacks like nuts, fruit, usually a protein bar. For lunch, and I admit I occasionally have to miss it because I'm in a meeting or something, but I'll have a couple of sandwiches and a salad most days. For dinner, usually something simple like lean meat and vegetables. My one treat every evening is something my wife makes called condensed milk fudge. It's very rich, but I can't resist it. I have that with some more coffee.
So, you enjoy a couple of coffees throughout the day?
Yeah, I like really milky coffee. It's more than a couple. I'm a bit of an addict. Oh, I guess that last one would bring the total to about 8 or 9.
Okay. And you'd consume that much every day?
Yeah.
That's definitely something we need to consider. As far as your general health is concerned, have you recently had any illnesses?
About a month ago, I had an upper respiratory thing that lasted about 3 or 4 days. Dr. Belfield just recommended bed rest, which is what I did. After I'd recovered, I went back to see him because I could feel my heart was pumping very fast and I was breathless, just going about my normal life. He said my heartbeat was over 100 a minute, which is very unusual for me. I think it's usually around 60 or 70. He put it down to the virus I'd just had. I saw him again soon after that because I'd broken out in hives. He suggested I take an over-the-counter antihistamine. I thought it was the change in weather, but I don't know because since then they've been reappearing at least once a week. The medicine helps at the time, at least.
The first thing I'd suggest is you change the brand of antihistamine every few weeks. You may find that'll be more effective. What we need to do is to get to the bottom of what's causing this. From what you've told me, I'd like to check if you are lactose intolerant. We can begin by doing what's called a trial run, meaning you need to avoid lactose for a few weeks and see if your symptoms improve. Once you have lactose again, if the symptoms return, then we can be pretty sure of the cause. However, if we're still uncertain, we'll likely carry out a hydrogen breath test and possibly even a blood glucose test to be sure. However, if we're still uncertain, we'll likely carry out a hydrogen breath test and possibly even a blood glucose test to be sure, and we can take it from there.
Okay, thank you, Doctor. I hope it's something so simple. I really appreciate you.
And that's the time. Let's check your answers. Remember that spelling counts, but you can use the US or UK spelling. For example, anemia can be spelled either ANEMIA or ANAEMIA, but either way, it must be spelled correctly to get the mark. So answer number 1 is puberty. She says she has struggled with weight ever since puberty. Number 2 is 6 months. The surgeon requires her weight to be stable for at least 6 months. Notice that this can be written as a number or spelled out, and both are correct. Number 3 is 1 meal a day. They said she ate at least 1 meal every day at the fish and chip shop. Number 4 is cake and ice cream. She said dessert was usually cake and ice cream. 5, the answer is watermelon. The only fruit that she enjoyed was watermelon. Number 6 is fizzy drinks. She indulges in desserts and fizzy drinks. Notice that she said fizzy drinks, but if you wrote soda or soft drinks because that's what you call them, you would actually be marked wrong. You must write fizzy drinks because that is the exact phrase used in the recording. Number 7 is slices of pizza. She gets 1, sometimes 2 slices of pizza. Number 8 is 2 to 3. She said she drinks 2 or 3 standard drinks. Number 9 is a CT angiogram. She has a CT angiogram booked for next week. Number 10 is soy. She said she was allergic to soy. Number 11 is bulimia. The doctor said she had bulimia. 12 is postnatal depression. She had postnatal depression after her last delivery. Okay, now let's move on to extract 2. For extract 2, number 13, the answer is a knotted feeling. He describes having a knotted feeling in his lower belly. Number 14 is rumbling noises. He mentions loud rumbling noises. Number 15 is swollen. He noticed that his belly looks quite swollen. Number 16 is high fiber. He says he eats high fiber cereals. Note that this can be written any of these ways. Number 17 is a protein bar. He sticks to snacks like a protein bar. Number 18 is lean meat. Dinner is usually something simple like lean meat and vegetables. Number 19 is milky. He likes really milky coffee. Number 20 is breathless. He felt his heart pumping and said that he was breathless. Number 21, hives. He said he had broken out in hives. 22 is brand of antihistamine. The doctor suggests changing the brand of antihistamine. Note here that the prompt says change blank. The audio says change the brand of antihistamine. You need to write the full phrase brand of antihistamine or the brand of antihistamine to make the sentence grammatically complete and accurate to the audio. Number 23 is trial run. The doctor suggested a trial run to test for lactose intolerance. Number 24 is a hydrogen breath test. If uncertain, they will carry out a hydrogen breath test. For the scoreboard, your target should be at least 20 points out of 24 for Part A. So, how did you do? Part A is the place to bank as many points as possible. If you scored under 18 here, practice your active listening and note-taking speed. Also look at the video OET Listening Top Tips right here on YouTube. For more detailed instructions and guidance with Part A, watch OET Listening Part A, which is linked in the notes. You can also sign up to e2language.com for free and look at the methods, videos, and additional practice tests. Next up, we're heading into the multiple choice section, Listening Part B. Let's jump right into Part B. This section tests your ability to understand the gist or purpose of a workplace interaction. The format here is 6 short extracts, which are approximately 45 seconds each. The context is a workplace interaction. That could be a handover, a briefing, or just a general discussion. The task is a 3-option multiple choice, A, B, or C. In this part, you'll hear 6 short audio recordings set in a healthcare workplace. You might hear a nurse briefing a colleague, a doctor talking to a supervisor, or a pharmacist speaking with a customer. Before we begin, let's talk strategy. The pacing here is critical. Before each track plays, you have 15 seconds to read the question. Here's how to use that time. Strategy 1 is the context statement. Read the sentence above the question first. This is the context statement. It tells you who is talking and what the situation is. This helps you predict the vocabulary and tone you are about to hear. Strategy 2 is to consider the question. So next, you want to read the question itself carefully. Are you listening for the main idea, a specific detail, or the speaker's purpose? For example, if the question asks, "What is the plan for today?" you know to ignore the information about what happened yesterday. Strategy 3 is to beware of distractors. OET loves to use synonyms. Do not just pick the answer that sounds like the word you heard. Often, the correct answer uses different words to describe the same idea. This is called paraphrasing. The incorrect answers might use the exact words from the audio, but in the wrong context. They do this to mislead you, so don't be fooled. Each recording is about 45 seconds and has one multiple choice question. You have 5 seconds after the audio ends to answer the questions. Okay, now it's your turn.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer, A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a dentist discussing the need for an X-ray with a patient. Now read the question.
So, Tim, there's some inflammation of the gums and it appears you may have 1 or 2 cavities as well. I'd like to do a new set of x-rays.
That doesn't sound like very good news.
It's just standard procedure, really.
I'm a little concerned about radiation. I don't want to end up with cancer just for standard procedure.
I can assure you the levels of radiation are minimal, and in your case it's important to ascertain whether you have any small areas of decay between the teeth.
But you've just told me I have some cavities and inflammation. Can't you see if there's any decay there?
Unfortunately, it's impossible to see just by the naked eye. We need to be sure, because if there is any decay, that can then lead to further complications down the road.
Okay, well, in that case, I guess we should.
Question 26. You hear a junior doctor discussing a patient's condition with her supervisor. Now read the question.
Hi, Dr. Drake. I need to discuss the current condition of a patient with you.
Sure.
It's Mr. Mendoza in bed 4. He's 46 years old, 5 days post-lap call. He's had increased abdominal pain over the last couple of days that hasn't settled with adjusted amounts of analgesia. He's normally fit and well. He's not on any regular medications and doesn't have any allergies. He's on day 5 of a course of oral coamoxiclav. Looking at his bloods, his white cells and CRP are rather high. He's febrile with a temp of 38.9, tachycardiac with a heart rate of 137, BP is maintained. On examination, his abdomen is soft and tender, especially in the right upper quadrant. His wounds look clean and dry, but I feel a little out of my depth and I'd like a senior review. In the meantime, I'll give him a fluid bolus and send off for some urgent bloods.
Question 27. You hear a pharmacist talking to a customer about high blood pressure medication for his mother. Now read the question.
Hi, my mother has high blood pressure and I'd like to find out what medications are available.
We stock both generic and brand name medications, but it's a matter of what your mother's doctor has prescribed. Has your mother been to see her GP?
She went a few days ago. He told her to go back next week to be tested again, but I'd like to know what's available for her to take now.
The decision to treat high blood pressure with medication is a complex matter. This won't be based solely on her blood pressure. but rather on her overall level of cardiovascular risk. There are many factors which need to be considered, like her current weight, level of exercise, salt intake and overall diet, whether she drinks alcohol or smokes, her medical family history.
So there's nothing I can pick up for her now that'll help her condition?
I'm afraid not.
Question 28. You hear a department manager talking to a nurse about a recent complaint from a patient. Now read the question.
John, Mrs. Hemming in room 5 has made a complaint saying that your behaviour was inappropriate earlier today.
I don't understand. How was I being inappropriate?
She says that you stormed into the room and demanded that her family leave immediately.
Well, firstly, I'd hardly say that I stormed in. I did demand they leave, and I may have sounded a little abrupt. You see, I notified them 5 minutes before the end of visiting hours and said they'd need to start saying their goodbyes. Then I went in again and politely explained their time was up and that Mrs. Hemming's mobile chest x-ray was on its way. 10 minutes later, when the radiographer arrived, I had to go in again and then again for a final time after he'd been kept waiting at least 6 or 7 minutes outside the room. He was quite annoyed.
I understand. I'll have a word with Mrs. Hemming now.
Question 29. You hear a nurse talking to his ward manager about a patient's personal belongings that have gone missing. Now read the question.
The porter says that the patient's belongings were in a clear plastic bag under the bed when he brought her back to the ward from recovery.
If that's the case, where's the bag now?
I haven't a clue.
Well, the only explanation is that the porter is wrong and the patient's belongings are still down at recovery.
I guess it's also possible that the bag could have fallen off the trolley on the way up.
That's highly doubtful. I'm sure the porter would have noticed if a bag had fallen off.
Still, I'd like to make sure. I'll walk back to recovery myself and have a thorough look on my way.
Check around his room before you go. Someone may have already brought it up while we've been talking.
Okay, no problem.
Question 30. You hear a podiatrist talking to a patient about her calloused feet. Now read the question.
As you can see, the bottoms of my heels and the outer edges of my feet are so rough. They're like sandpaper.
Sure, it's very common.
They're not painful, but they look horrible. The biggest problem for me is that I love my long strolls on the beach in the evenings after work, and I've had to stop that now.
I see. And what do you typically wear on your feet when you go on these walks?
Just a pair of sneakers, rubber-soled shoes. I never wear socks because sometimes my feet get really soaked and I hate having to dry them as well as the shoes. And also, the sand gets caught in the fibres, which is almost impossible to get out.
That could actually be making things worse because it can cause friction on your feet.
Oh, I see.
How did you do? Let's review it. We'll break each of these questions down. In Part B, understanding why an answer is wrong is just as important as knowing why it is right. Question 25. The dentist. The correct answer is B. The oral examination is limited in scope. The dentist says, unfortunately, it is impossible to see just by the naked eye. So this implies that the visual exam has limits. Answer A is a distractor. The dentist isn't uncertain if cavities are present. They already found inflammation in cavities. They need the x-ray to check for decay between the teeth. Answer C is also a distractor. He mentions it's standard procedure, but the reason for doing it isn't just because of policy, it's to find the hidden decay. Question 26 is the junior doctor. And the correct answer is C, to seek assistance from a more qualified doctor. The doctor says, I feel a little out of my depth and I'd like a senior review. In answer A, she provides an update, but that is the content of the talk, not the purpose. The purpose is to get help. In answer B, she mentions the pain hasn't settled with adjusted analgesia, but she isn't asking to adjust it again. She's asking for a review of the patient's condition. Question 27, the pharmacist. The correct answer is A. Discuss all contributing factors with her GP. The pharmacist provides many factors, weight, diet, etc., and says the decision is complex and depends on what your mother's doctor has prescribed. The implication here is that she must return to the GP to sort through these factors. Answer C is a distractor. The pharmacist mentions lifestyle factors, but doesn't tell the son to change them directly. She says they need to be considered by the doctor before medication is chosen. Answer B is also a distractor. While the pharmacist does mention that they stock both generic and brand name medications, he explicitly says it is a matter of what your mother's doctor has prescribed. He does not recommend one type over the other himself. Question 28 is the complaint. The correct answer here is A. His manner was appropriate. The nurse defends himself. He says, I'd hardly say that I stormed in. I politely explained. Here he's arguing that his behavior was correct. In B, the radiographer was kept waiting, but the nurse isn't complaining about the delay. He's using the delay to explain why he had to enter the room multiple times. For answer C, the nurse mentions that the radiographer was quite annoyed, but he never says that the patient was rude. He implies her complaint was factually wrong, but does not accuse her of rude behavior. Question 29, missing belongings. The correct answer is A. They were lost on the way to the ward. The nurse says, I guess it's also possible that the bag could have fallen off the trolley on the way up. In answer C, the ward manager thinks that they are in recovery, another part of the hospital, but the nurse doubts this. She says that's highly doubtful. So why not B? Pay attention to who is speaking. It is the ward manager, or speaker 3, who suggests check around his room before you go. The question asks what the nurse, that's speaker 2, believes, and he simply agrees to check it. He says, okay, no problem, rather than suggesting it himself. Question 30, the podiatrist. The correct answer here is C, wearing shoes without socks. The patient says she never wears socks. The podiatrist replies, that could actually be making things worse, because it can cause friction. For answer B, walking on the beach is the activity, but the cause of the callus is the sand because she isn't wearing socks. So why not A? The patient mentions her feet get really soaked, but this is the reason she doesn't wear socks. The podiatrist identifies the lack of socks, referred to as that, as the cause of the friction, not the wetness itself. So overall, the patient mentions walking on the beach and getting wet feet, but the podiatrist identifies the friction caused by the lack of socks as the root cause. So, how many did you get right? 6 out of 6 is the goal, but 4 or 5 is a solid pass. Want to gain an understanding of how you'd fare on the OET for free? E2 has a free score calculator exam linked in the description below. If you struggled with the speed of these extracts, you need to practice listening for gist. Don't get hung up on one word. Listen for the speaker's main intent. For more support, read the blog post, OET Listening, Tips and Practice for Success. If you need more detailed instructions and guidance with Part B, watch OET Listening Part B, which is linked in the notes below. Next up is the final listening section, Part C. This is where we test your endurance. In Part C, the format changes. You're no longer listening to short consultations or brief workplace chats. Instead, you'll hear 2 longer recordings lasting about 4 to 5 minutes each. The format here is that there are 2 extracts with 6 questions each, and a 3-option multiple choice, A, B, and C. These recordings simulate professional development. You might hear a presentation on new research, a case study review, or an interview with a specialist. Each extract has 6 multiple choice questions. Before we begin, let's talk strategy. Because these recordings are long, getting lost is a real risk. So here's how you stay on track. Strategy 1 is the 90-second prep. You have 90 seconds before the audio starts. During this time, you should read the questions first, not the options. This gives you the outline of the talk. Then you want to go back and read the A, B, and C options. Strategy 2 is signposting. The speakers will help you. Listen for signposting language. If you hear things like, "That brings me to my next point," the speaker is moving on to the next question. If you hear "however" or "but," pay attention, as the speaker is often about to contradict a previous point or give their real opinion. Strategy 3 is attitude and opinion. Part C tests attitude and opinion, so don't just listen for facts. Listen for how the speaker feels. Are they surprised, concerned, optimistic? The answer is often hidden in the emotion, not just the data. Let's begin the mock test Part C. We have 2 extracts today. In Extract 1, you'll hear a behavioral health consultant named Stephanie Peters discussing the impact of social media on adolescents. You have 90 seconds to read questions 31 to 36.
Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer, A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You hear a behavioural health consultant called Stephanie Peters giving a presentation to a group of healthcare providers about the impact of social media on adolescent mental health. You now have 90 seconds to read questions 31 to 36.
Hi, my name's Stephanie Peters, and I'm a behavioural health consultant. I'm here to speak on what is a rising trend in today's multimedia world. That is, the impact social media has on the mental health of its largest group of users, teenagers. According to a recent study, teens spend as much as 9 hours per day on social media. That mind-boggling statistic means that when they're not in school or sleeping, teens are glued to their phones, where they interact with friends and the rest of the world through the likes of Instagram, Snapchat, Facebook, and a variety of other channels. Perhaps a staggering amount of time for those in my generation, but not so for Gen Y and Z. Yet what exactly is this endless stream of communication doing to them? Being a relatively new form of communication, this remains an unknown. But while it's a way to connect with friends and information, which can be positive, the always-on aspect of social media can be exhausting, and it can take a toll on a teen's mental health. Given the rising number of social media apps, it's essential to keep on top of the effect this has on our children. The UK's Royal Society for Public Health surveyed 1,500 teens and young adults about their social media habits. They found that such social networks are associated with high levels of anxiety, depression, bullying, and what has become known as FOMO, or a fear of missing out. On top of this, they can also foster body image issues and poor sleep habits. As this study and others have suggested, the more social media young adults consume, the more likely they are to report depression or anxiety. It becomes a full-time job to check, monitor, and respond to social media requests and demands from multiple sources, something I personally consider as simply too much for any brain, particularly a developing one, to handle. Another dangerous aspect of social media is that it's easy for teens to compare themselves to others. With the click of a mouse or the swipe of the screen, they have access to a whole world of friends and strangers alike. However, what they see is frequently not a reflection of real life. This state of physical comparison is a big issue because we seem to take everything on social media at face value. We live in an age where the norm to falsify selfies with image-altering filters and editing programs is so simple that even a child can do it. Some may say this is harmless fun, but this constant comparison to unrealistic ideals can result in low self-esteem, self-doubt, poor body image, and the fear of missing out. Boys and girls alike struggle to keep up with their peers, and they're spending more and more of their time trying to live up to these unrealistic expectations and retouched pictures. Teens aren't likely to give up social media, but there are healthier ways to use it. I, like many other mental health professionals, advocate for tactics like heavy usage warnings that pop up when someone has spent an excessive amount of time on a particular site, as well as warnings about digitally altered images. But what measures can teens personally take to protect themselves, especially if they are experiencing pressure or increased feelings of depression and anxiety associated with social media? This is what my colleagues and I spend our days pondering. What is needed is a set of clear steps that can be encouraged by parents and are accessible to all users of social media. Media mindfulness is one such step. It's important to ask questions like, are my shoulders raised and tight? Is my jaw clenched? Am I smiling or laughing and genuinely happy while online? What am I thinking? Am I comparing myself to this person? Does this feel good? Is this helpful? Is this a good use of my time? Having such questions in the backs of our minds while we're on social media platforms can help us be more active in our choices and helps us filter through the less positive influences out there. Facebook Friday or Facebook 15 are terms we've coined for actions that we hope teens will take to help limit their usage. The former is a reminder to use social media once a week for those who want to give up daily usage. This strategy works equally well with other social platforms, such as Snapchat Saturday or Twitter Tuesday. Facebook 15, on the other hand, simply limits usage to 15 minutes for any social network. Nothing but notifications is less restrictive by logging in and checking only when a notification is received. This limits any interaction to close contacts and eliminates mindless scrolling. Such measures are in no way meant to take social media platforms away from teens, but rather allow them to take control of their interactions and use social media in a more constructive way, and this can have a dramatic impact on mental health. Thank you.
Extract 2 is opioids for chronic pain. So let's move on to Extract 2. You'll hear an interview with Dr. Jessica Rhodes, a pain management specialist, discussing opioids. You have 90 seconds to read questions 37 through 42.
Extract 2, questions 37 to 42. You hear an interview with Dr. Jessica Rhodes, a pain management specialist, discussing the use of opioids for chronic pain. You now have 90 seconds to read questions 37 to 42.
Today we're talking to Dr. Jessica Rhodes, a pain management specialist, who will be discussing the use of opioids for chronic pain. Thank you for your time, Dr. Rhodes. Can you start off by outlining what you see as the issue with the prescription of opioids today?
Well, opioids like codeine are often prescribed for chronic pain, head pain, pelvic pain associated with osteoarthritis, and lower back pain. Indeed, many patients specifically request them from their doctor when they're suffering from these conditions. This is understandable because they're suffering and desperate for a solution, and they think that these drugs will be effective. But we've seen time and time again that this type of medication doesn't work for patients with chronic pain and can lead to potentially harmful side effects, as well as dependency. Yet, opioids, often strong ones, are still prescribed for chronic pain by many doctors. This constant cycle of common conditions being treated with ineffective medication is leading to more problems than it's solving.
You recently completed a study at the University of Maine examining opioid use for chronic pain. What did you and your team discover?
We decided that we wanted to understand who is being prescribed these drugs and why. So we collected over 40 observational studies from all over the world that examined the prescription of opioids for chronic pain, and we noticed that over the years, the percentage of patients being prescribed opioids for these conditions had increased. For example, in some of the earlier studies, which were from 1991, this proportion was 20%, and by 2016, this was 40%. So really, over a 25-year period, the proportion had doubled. It's important to remember that these studies were done mainly in Britain and America, So the results of our review need to be considered with caution in terms of being applied to other contexts. But we know from other studies that the trend seems to be global.
What type of opioids are doctors generally prescribing?
There's a huge range of opioids available on the market, with some being more potent than others. Obviously, they each have different applications and different dangers associated with their use. The studies we examined looked at the prescription of both strong and weak opioids. We'd assumed that weak opioids, like codeine, would be prescribed more frequently than stronger ones. However, weak opioids were prescribed in 8.5% of cases, and strong opioids, like oxycodone, were prescribed in 21% of the cases we saw. So what was shocking was that strong opioids are being prescribed quite often, much more frequently than we thought, which is quite concerning. Then, of course, the remaining cases were those that were prescribed combination medicines, which contained small amounts of a weak opioid.
Why do you believe that opioids are being prescribed so often for chronic pain?
That's a good question. The thing is, in the past, they were considered an appropriate treatment option for these conditions, even though it wasn't seen as first line. As we've found more evidence of potential harm and realised that the benefits don't outweigh the risks, the guidelines have changed. So the idea of these drugs being an inappropriate choice for chronic pain management is actually relatively new. However, many doctors are yet to make a shift and continue to follow previous recommendations. As we all know, changes recommended by research can take some time to trickle down to real-life practice. So if we were to repeat this study in 20 years' time, we would hopefully see this change starting to take effect. For the moment, it's just a matter of trying to get the message through using the knowledge we already have.
Why aren't doctors recommending that these patients stop taking opioids?
The main problem is that GPs are frightened to do this because patients show a lot of resistance when it's brought up. There are also other barriers like withdrawal symptoms, which can be a concern for both doctor and patient. It's also not something you do suddenly because of the potential consequences. So if a doctor believes that other treatment options should be explored, they need to be prepared for some opposition from the patient. Similarly, if a patient's taking opioids and they feel that it's not working for them, it's important that they speak to their doctor and not stop all on their own. Either way, a plan needs to be made that both doctor and patient feel comfortable with.
Are there alternatives for the treatment of chronic pain?
Well, there are several options, such as different types of medication, including anti-inflammatory drugs like ibuprofen or topical creams, depending on the site and source of the pain. Research into non-pharmacological treatments, like the mindfulness approach, are also getting a lot of good results. The difficulty is that pain is complex, and there's no one treatment that is suitable for all conditions. If you've had pain for a long time, a solution needs to be found using a team of doctors, psychologists, physiotherapists, and other healthcare professionals. It's all about getting you back on track and rehabilitated, so you really need to come at it from a lot of angles.
Very true. Thank you for your time, Dr. Rhodes.
Thank you.
Well done. How do you feel like you did? That was a lot of listening. So let's break down the answers and look at the evidence in the text. We'll look at some of the trickier questions in more detail. Extract 1 is Stephanie Peters. Question 31 asks, what does Stephanie imply about teenagers' use of social media? The answer is B. They spend too many hours connected online. She cites a mind-boggling statistic that teens spend 9 hours a day online, saying the always-on aspect can be exhausting. So why not A? She mentions that they interact with friends, not that they are isolated. For question 32, Stephanie believes that the amount of social media sites is overwhelming for teenage users. Answer A. She says checking multiple sources becomes a full-time job and is simply too much for any brain to handle. Why not B? She mentions it is essential to keep on top of the effect this has, but she is referring to monitoring the effect, not necessarily saying the sites themselves need closer monitoring. Why not C? She says the effects remain unknown, but she attributes this to social media being a relatively new form of communication. not specifically because the number of sites makes it hard to identify. For question 33, Stephanie highlights that people's lives portrayed on social media are extremely easy to manipulate. Answer C. She states that falsifying selfies with editing programs is so simple that even a child can do it. For question 34, what does Stephanie say about reducing the negative impact? She said users need to be more discerning about the content they consume. Answer A. Stephanie asks, what measures can teens personally take? She then answers this by suggesting they ask questions to help them be more active in our choices and filter through influences. Why not B? She does mention warnings and alerts that pop up when someone has spent an excessive amount of time. However, she lists this as something she advocates for. She mentions platform-level changes, not a step that teens can personally take themselves, which is the specific focus of this question. What about C? She says steps can be encouraged by parents, but she does not explicitly state that parents need to monitor usage more closely. Question 35. Stephanie suggests that using a technique called media mindfulness encourages users to consider the impact of social media. That's answer B. She lists questions users should ask, like, does this feel good? Is this helpful? This encourages considering the impact. Question 36. Why are initiatives such as Facebook Friday effective? The answer is question A, because they can be used across all platforms. She explicitly says this strategy works equally well with other social platforms, such as Snapchat Saturday or Twitter Tuesday. Let's move on to extract 2. For question 37, Dr. Rhodes believes the main problem with the prescription of opioids is that they are being used incorrectly for conditions they do not help. Answer B. She states we've seen time and time again that this type of medication doesn't work for patients with chronic pain. Question 38. What was the main finding of the study conducted at the University of Maine? That the number of patients being prescribed opioids was getting higher. Answer A. She notes that over a 25-year period, the percentage of patients being prescribed opioids had increased and, in fact, doubled. So why not B? She mentions that the results need to be considered with caution regarding other contexts, but she actually concludes the opposite of option B. The trend seems to be global, meaning the trends are likely similar, not different. Question 39. What did Dr. Rhodes find surprising? That strong opioids were recommended at a higher rate than was expected. Answer C. She says what was shocking was that strong opioids are being prescribed quite often, much more frequently than we thought. Question 40. Why does Dr. Rhodes believe opioids are frequently prescribed? Because many doctors have not adapted to new guidelines. Answer C. She explains that the idea of these drugs being inappropriate is new, and many doctors are yet to make a shift. Question 41. Dr. Rhodes suggests that doctors are not ceasing opioid treatment because they are worried about patient reactions. Answer B. Dr. Rhodes explicitly states the main problem is that GPs are frightened to do this because patients show a lot of resistance. So why not C? She does mention withdrawal symptoms as a barrier. However, she introduces this as an additional point. There are also other barriers, whereas the question asks for the primary reason, which she identifies as the fear of patient resistance. Question 42. What does Dr. Rhodes believe about alternatives? That they require a multidisciplinary approach. Answer A. She states that a solution needs to be found using a team of doctors, psychologists, physiotherapists, and other healthcare professionals. Congratulations! You have completed the entire listening mock test. Let's take a look at the scoreboard. Count up your score. Remember, for a grade B, you're aiming for around 30 out of 42. If you found Part C draining, that's normal. It requires stamina. One way to improve is to listen to podcasts and TED Talks on healthcare topics outside of your specialty. For more detailed instructions and guidance with this section, watch OET Listening Part C, which is linked in the notes below. Take a quick break if you need one, then get ready for the reading section. In the actual exam, there will not be a break until after reading Part A, so if you're attempting to simulate the exam, keep going. Before we start the reading section, I recommend you download the answer booklet. With this booklet, you'll be able to work alongside this video for each task. Be sure to like and subscribe while you wait for your booklet to download. Now we're going to work on the second task you'll complete on exam day, the reading section. Before we get started, let's talk about what to focus on in order to succeed in the OET reading test. Success in reading is often based on vocabulary and the ability to recognize keywords in the questions and options and being able to match them with the paraphrased words and collocations in the passage. Another area to focus on is time management. Be sure that you do not rush and that you read the entire sentence or the whole question before answering. Many people go too quickly and answer the questions before finishing the sentence, thus missing the key details, which actually guide you to the correct choice. The reading section often catches people off guard because of the pacing. You have 60 minutes total. It's split into Part A, which is a 15-minute speed reading sprint, and Parts B and C, which are deeper reading tasks lasting 45 minutes total. Let's start with Part A. Part A has 4 texts, A, B, C, and D, and 20 questions. It has a strict time limit of 15 minutes. Part A tests your ability to skim and scan. For tips on skimming and scanning, read OET Reading FAQs or watch OET Reading Part A Exam Method Tips and Strategies. Both of these are linked in the notes below. You'll be given 4 short texts on a single healthcare topic, and you must answer 20 questions in just 15 minutes. Let's talk about some strategies. Copy exactly. Make sure you use the exact words from the text. Spelling counts. Incorrect spelling means no marks. Don't use abbreviations unless they're specifically in the text. I cannot stress this enough. In Part A, you must write exactly what is written. If the text says chronic vestibular symptoms, but you just write chronic symptoms, you might lose the mark. You must copy the words exactly as they appear. Also, spelling counts. If you misspell a word, you get 0. Both American and British spelling are accepted, but the word must be spelled correctly. For Part A, it is imperative to skim read all 4 passages to have an idea of what is in each one. Remember, skimming is not a waste of time. Skimming will actually speed up your ability to scan later in order to find exactly where the information is located. Also remember that you should always complete the test in the correct order. Those first 7 questions are the foundation to knowing what information is where and will help you complete the other 14 questions much faster. Remember to double-check the questions and look at the specific information you have chosen for your answer. Before we start the clock, here's your final strategy. Do not try to read every word in detail. For the first 2 minutes, you want to skim. You should read the headings, subheadings, and the first sentence of each paragraph to understand, in general, what is in text A, B, C, and D. Next, you want to scan. You should do this in minutes 3 through 15. Read the question, find the keyword, for example, a drug name or symptom, and zoom in on that text to find the answer. Are you ready to try it? Here is Part A of the mock test. We're going to simulate the test conditions. I'm going to show you the texts and the questions, or you can download the booklet linked in the description. You have 15 minutes. We'll start the timer now. Okay, pencils down. That was 15 minutes. Let's see how you did. We're going to go through these answers rapidly. Be sure to check your spelling as we go. A note on strategy for questions 1 through 7. These questions just ask where the information is. You don't need the specific details, just the location. Number 1, D. Number 2, letter C. 3, A. 4, D. 5, B. 6, A. 7, B. Did you get those? This is usually the quickest part of the test. If you struggled here, try working on your skimming skills. A quick strategy note for questions 8 through 14. Keep these answers short, 3 words max. Question 8 is sitting. Question 9, associated hearing loss or hearing loss. Number 10 is prochlorperazine. Number 11 is all types or all. 12 is benign positional vertigo or BPV. Number 13 is brainstem involvement. Number 14 is vestibular migraine. Look at question 11. The text says all types of vertigo. So if that's what you wrote, that's correct. If you just wrote all, that is also correct. But if you wrote most types, that is wrong. Remember, precision matters. Many candidates get this question wrong by answering benign positional vertigo or BPV. This happens because they scan for the word movement or position, which would lead them to text B. In text B, it explicitly says BPV is brought on only by positional changes. So why is that wrong? The question asks what is exacerbated, which means worsened, by head movement, not just what is triggered by it. You need to look at text A, which considers the general rule all types of vertigo worsen with head movement. Don't stop at the first keyword match. Check if there is a broader rule in the introductory text, text A, before diving into specific tables, like text B. Now let's look more closely at question 13. What does an abnormal result in the test of skew usually indicate? The correct answer is brainstem involvement, but candidates often incorrectly answer central pathology. This error comes from reading text C too quickly. The sentence reads, although this is a less sensitive test for central pathology, an abnormal result is fairly specific for brainstem involvement. Grammatically, the text says the test is less sensitive for central pathology. The specific thing an abnormal result points to or indicates is brainstem involvement. Remember, in OET Part A, it is vital to read the entire sentence to understand the relationship between the clauses. Now let's move on to questions 15 through 20, which were sentence completion. A quick strategy note here, these must be grammatically correct within the sentence provided in the question. Number 15 is chronic vestibular symptoms. Number 16, positional change or positional changes. Number 17 is notoriously unreliable or unreliable. Number 18 is peripheral. Number 19 is a stroke or stroke. 20 is central etiology. For question 17, notice that the text says notoriously unreliable. If you included notoriously, great. If you just wrote unreliable, that fits the grammar of the sentence too, so it's accepted. Let's look more closely at question 19. If all 4 main signs of vestibular neuritis are not present, the patient may have had. The correct answer is a stroke, but you can also just write stroke. Candidates often struggle to find this answer because it's not inside a standard cell in the table. In text B, the main columns list acute vestibular syndrome and vestibular neuritis. Candidates look down the presentation column and see symptoms like sudden severe episode or positive head impulse test. The correct answer is located in a conditional row spanning across the bottom of that section. If all 4 above conditions are not met, a stroke should be considered. When reading tables in Part A, do not ignore rows that span across columns or footnotes. They often contain critical exclusion criteria or exceptions. Let's look at the scoreboard. Remember, for a grade B, you need to get around 30 out of 42. So now count up your points. To be on track for a grade B or score 350 in reading, you typically need to get at least 30 out of 42 correct across the whole test. Since Part A is the easier section to score points in, you really want to be scoring between 16 and 18 out of 20 here to leave yourself a buffer for the harder parts later. Next up, we'll tackle reading Part B. In the actual exam, there's an optional 10-minute break after reading Part A. Take that break now if you'd like, but before you go, be sure to like and subscribe to ensure you can pick right back up from where you left off. Reading Part B consists of 6 short extracts, all within a workplace context, and lasts for around 45 minutes total for Parts B and C. In a single shift, you might read a hospital policy, a memo about waste disposal, or an email about new guidelines. Part B tests your ability to handle these standard workplace communications. You'll see 6 short extracts, each about 100 to 140 words long. Each extract has 1 multiple choice question with 3 options, A, B, or C. Time management here is tricky. You have 45 minutes to complete both Part B and Part C. Since Part C involves longer, heavier texts, you don't want to spend too long on Part B. We recommend spending about 10 to 12 minutes here. Before we start the clock, let's look at how to approach these questions. Tip 1 is to read the question first. Unlike Part A, where you skim the text first, in Part B, you should read the question first. This tells you if you are reading for gist, the overall message, or for specific detail. Tip 2 is to watch for modal verbs. Must means it's mandatory. Should means it's recommended. And can is optional if the text says a nurse should check an ID, but the answer says must, that answer is usually wrong. For example, if the text says staff should consider a procedure, but the answer option says staff must use it, that option is wrong. Precision with modal verbs is key. Tip 3 is the whole answer rule. Make sure every part of the answer option is supported by the text. If an option is half true, it is 100% wrong. Okay, let's put this into practice. I'm going to show you 6 questions. On each slide, read the question, then the text, and choose the best answer. Are you ready? Here's question 1. Let's break down the answers. This is where we learn why an answer is right and why the others are just distractions. For question 1, the correct answer is C. Records must hold an adequate amount of information at all times. The text says records should be sufficiently detailed to allow another GP to take over. This matches adequate amount of information. A is wrong because the text mentions eligibility is important, but doesn't say it is a common cause for concern. B is wrong because the text says practices should consider a recall system, not that it must be used. This is a classic modal verb distractor. For question 2, the correct answer is B. Medical jargon should be avoided. The text instructs you to use language that can be understood by all members of the public. This is a paraphrase of avoiding jargon. A is wrong because a family member is only needed if in attendance or if the patient's condition permits. It is not a blanket rule. C is wrong because the text mentions liaising with senior physicians where necessary, but does not say they should conduct the interview. For question 3, the correct answer is B. The required scrub time may vary between hospitals. The text states every hospital develops its own procedure specifying the length of the scrub. This implies variation between institutions. A is wrong because you only re-scrub if the glove has leaked, not for any puncture. C is wrong because it is compulsory for the surgical team, those touching the sterile field, not everyone entering the room, like an anesthesiologist or circulating nurse, might not scrub. For question 4, the correct answer is A. Staff are responsible for their own personal safety. The text emphasizes that staff must follow protocol, and if they don't, their safety is compromised. B is wrong because the text says disposal is expensive, so costs are a high priority, contradicting option B. C is wrong because the text explicitly states only 15 to 20% of medical wastes are considered infectious, so they do not make up most waste. Note that C was a distractor. The text says only 15 to 20% of waste is infectious, so most waste is not infectious. For question 5, the correct answer is C, to outline considerations when assessing patients. The text explains that weight isn't the only factor. Dimensions and mass distribution must also be considered to ensure the patient fits. A is wrong because it doesn't list specific equipment, but rather requirements for the equipment. B is wrong because it mentions road and air, but doesn't compare them for efficiency. For question 6, the correct answer is C. Be ready for unexpected items needed during the procedure. The text advises including space for consumables that may be added mid-case, which prepares for unexpected needs. B is wrong because it says create a standard list, implying that staff create it, not that it is supplied by the hospital. A is wrong because the text is about counting, not handling instruments. So, how did you do? Part B is all about precision. If you found yourself guessing, you might need to work on your grammar and ability to spot paraphrasing. We have loads of practice questions just like these at e2language.com and e2english.com. We have arrived at the final reading section, reading Part C. By the time you get here on test day, you might be feeling a bit tired, but you need to stay sharp. In Part C, you'll read 2 longer texts that are about 800 words each. They are articles you might find in a medical journal that deal with research, new technologies, or opinions on healthcare trends. This section consists of 2 texts, 8 questions each, so 16 in total, and they have a 4-option multiple choice. Each text has 8 multiple choice questions. Here you need to understand explicit meaning, so what is clearly stated, and implicit meaning, what the writer is suggesting. A major trap in Part C is confusing the writer's opinion with a fact, or confusing what the writer thinks with what a researcher mentioned in the text thinks. You must look for specific evidence in the text to support your choice. Let's talk about some strategies. The first one is to read with purpose. Do not read the whole text before looking at the questions. That just wastes time. Start with the first question of Part C, read the question, Find the keywords and then go to the text. The questions follow the order of the text, so the first question is usually in the first paragraph. The second strategy is reference words. You'll see questions asking what it, this, or they refers to. These are reference questions. To answer these, you almost always need to look at the previous sentence to find the noun or idea being replaced. The third strategy is elimination. Use the process of elimination. If an option is mostly right, but has one detail that contradicts the text, it's wrong. Narrow your choices down to increase your odds. So let's get into part C of the mock test. Here we have two texts. The first is A New Era for Mind-Body Medicine, and then Physician Burnout. These texts are long, so you may want to download the booklet in the description to read along. I'll show you the text segments and the matching questions. Welcome back. Let's analyze a few of these questions to see how the answer is found. I won't go through every single answer, but I'll pick out the tricky ones that test specific skills. Question 7 asks, what does the writer suggest about meditation in the first paragraph? The correct answer is A. The way it has been viewed in medicine has changed positively over time. The text starts by saying 50 years ago it was considered fringe and absurd. Then it says research has shown physiological effects or relaxation response, and its existence is undeniable. Let's talk about why B is wrong. The text says its existence is undeniable, so benefits are not still questioned. C is wrong because the text says interest has occurred largely within a secular context. Secular means not connected with religious or spiritual matters. D is wrong because the text lists physical and mental health benefits in addition to general stress relief, and specifically mentions the physiological changes like lowered blood pressure and heart rate. Therefore, the benefits are not limited to just stress relief. Now let's look at question 10. Question 10 asks, what does this refer to in the fourth paragraph? The text says, despite this, many patients are keen to learn more. The correct answer here is D, the potential barriers to the use of mind-body treatments. We need to look at the sentences before the word this. The previous sentences list barriers, such as religious concerns, effort required, and mental illness risks. This refers to that collection of difficulties or barriers. Now let's look at question 14. Question 14 asks, what does the expression optimal dosing refer to? Here, the correct answer is B, the amount of mind-body therapies appropriate for each patient. Now, typically, dosing is used for medication, but here, the writer uses it metaphorically for meditation. Now let's look at question 16. Question 16 asks, what problem does the writer raise in the second paragraph? The correct answer is B. Current initiatives do not focus on the real issue. The text lists initiatives like exercise classes and hobbies. It then says, such proposed solutions do not address the underlying problem. Many people may answer D, but this is incorrect. While the text mentions advice came from politicians and psychologists, the problem raised is the lack of alignment, not the source of advice. Now let's look at question 21. What does the word it refer to? The text says, this is paramount in scheduling as it recognizes that both patients and doctors are individuals. The correct answer is C, the flexibility that doctors need. This is a really tricky chain. It refers to the subject of the sentence, which is this. So what is this? You have to look at the previous sentence. This provides doctors flexibility in their schedule. For this one, you have to chain the logic back 2 sentences. Now let's go over the full answer key. Here are the answers for the questions we didn't cover in depth. Pause the screen to check your score. And that's it. You've completed a full reading mock test. Well done. If you found Part C challenging, don't worry. It's designed to be difficult. The best way to improve is through consistent practice and vocabulary building. At e2language.com, we have a library of these articles and expert tutorials to help you master the implicit meaning questions. Now we're going to complete the writing section. Before we start, I recommend you download the answer booklet if you haven't already. To ensure you receive all future OET videos and exclusive tips, like and subscribe while you wait for your booklet to download. So, this is what the writing subtest will look like on test day. You can see that the time allowed is 5 minutes for reading and 40 minutes for writing. Below that is a set of case notes. The case notes are profession specific, so nurses will get nursing case notes, doctors get medical case notes, dentists get dentistry case notes, and so on. Below the case notes, you'll see the writing task. It will specify whether you need to write a referral, transfer, or discharge letter. It doesn't tell you exactly what to write, but it guides your writing by specifying who you're writing to and why. This is vital information. because it helps you work out what details from the case notes are relevant and must be included in your letter, and what is irrelevant and should not be included. Our top tip: read the task first before you start reading the case notes. The instructions at the bottom are standard. They remind you to expand relevant notes into complete sentences, do not use note form, and to use correct letter format. This means you need to use grammatically correct sentences and coherent paragraphs. The word limit is approximately 180 to 200 words. It's important to note that during the 5 minutes of reading time, you cannot use a pen or pencil. Use this time to read the notes, make a mental plan, and decide what is relevant. If you're feeling nervous, use this time to breathe and refocus as well. Let's take a quick look at how OET writing is scored. Knowing what criteria your letter is being assessed against will help you to write a high-scoring response. There are 6 criteria. Purpose is scored out of 3, and the rest are scored out of 7. To summarize them: purpose. Is the reason for the letter immediately clear to the reader? Content. Did you include the necessary information and leave out the distractions? Conciseness and clarity. Is the length appropriate? Did you avoid unnecessary words? Genre and style. Is it formal and professional? Are you using facts rather than judgment? Organization and layout. Is the information grouped logically by theme? Language. How are your spelling, grammar, and vocabulary? Remember, a high-scoring response demonstrates clarity, coherence, and precision. Avoid irrelevant details and focus on the most important information that the recipient needs. For more information on the scoring for OET writing, head to e2language.com and sign up for an OET package. Here you'll find explainer videos that go into detail and give examples for OET writing criteria, as well as tons of writing practice. Sign up for free today. If you haven't already, now is also a good time to download the booklet to follow along with the writing section. Before I start the clock, let's do a quick relevance check together. This is the secret to a high score. You want to look at the writing task first. We are writing to a gastroenterologist. Everything we include in the letter must be relevant to her specialty in the patient's suspected condition, GERD or GERD. Now scan the social background. We see the patient runs a clothing business, has a husband named Gregory who is a police officer, and children living abroad. Ask yourself, does a stomach specialist need to know her husband's profession? Probably not. But does she need to know the patient was a heavy smoker for 26 years? Absolutely. This is a risk factor for gastrointestinal issues. Now look at the medical history. We have COPD and bronchitis. These are relevant because we need to distinguish between lung pain and stomach pain. But look here, Bankart repair right shoulder and rotator cuff tear. Ask yourself, is an old shoulder injury relevant to her current heartburn and chest pain? Unless she's taking painkillers for it that hurt her stomach, it's likely just irrelevant clutter. Finally, look at the presenting complaint. You'll see compression-like pain, improved with pillows, and large meals late at night. These are the specific details the specialist needs in order to confirm the diagnosis. So, as you write, imagine you are the specialist. If a piece of information doesn't help you treat the patient, leave it out. On the next slide, I'm going to show you the case notes. We'll set a timer for 45 minutes. 5 minutes for reading and 40 for writing. Welcome back. Since I can't look over your letter, pause and take a look at the sample letter provided and see how it compares to your own. If you'd like your own writing reviewed by an OET expert, sign up for a package at e2language.com. You may also like to look at our ebook, OET Writing Super Methods, and the video, How to Pass OET Writing, linked in the notes below. An overall score for this letter would be between a 6 and a 6.5 out of 7. However, to be perfect, it needs some tweaking. Let's break it down by criteria. First is the purpose section. Currently it says, I'm writing to refer Mrs. Henning for your professional assessment following recent bouts of nocturnal chest pain. The purpose is clear, but it could be sharper. Make sure the specialist knows immediately why you're sending the patient. It would be better to say, I'm writing to refer Mrs. Judith Henning, who has a provisional diagnosis of gastroesophageal reflux disease, for your assessment and confirmation. The second section is content and conciseness. The content was generally good and did not include any irrelevant social history. However, the letter was slightly over the word count at 231 words. So let's look at how to be more concise. The original version says her pain is only present when recumbent and typically after consuming large meals, especially at night. This is 16 words. It would be more concise to say the pain occurs only when recumbent, typically after large evening meals, which is 11 words. See that? We saved 5 words and improved the flow. Let's look at another one regarding her COPD. The original says her physical examination was unremarkable and it is not believed that her COPD or medication is the cause of the new onset of chest pain. Instead, we could write, her physical examination was unremarkable and neither COPD nor her inhalers appear to explain this new chest pain. Try to say more with less for this section. Let's move on to genre and style. The tone was professional and polite. One small formatting note regarding the re line. While RE in all caps is common in many US hospitals, OET actually prefers RE with a capital R and a lowercase e. This makes it a preposition meaning regarding. Also, always use the date of birth rather than just the age if the case notes provide it. You should not be spending time calculating the age yourself. Age is acceptable only when there is no date of birth given. Now let's talk about language. Grammar and spelling were spot on. Note that OET accepts both American and British spelling conventions, so esophagus with an E or an O are both correct, as long as you're consistent throughout the letter. An important note on date formats. The sample uses 6/1/2019. In the US, we'd read this as June 1st. In the UK and Australia, this is January 6th. To avoid confusion, write out the date in full, 1 June 2019 or June 1st, 2019. This is accepted universally and ensures no confusion. So, how did your letter compare? Did you capture the provisional diagnosis in the first paragraph? Did you manage your word count? If you want your writing graded by expert teachers who can give you specific feedback on your grammar and structure, head over to e2language.com. We have specific courses for nurses, doctors, pharmacists, and more, all that will get you test ready. Whether you take your test in the testing center or using OET at home, the writing subtest will conclude your session. The speaking subtest is done separately. It's delivered individually and should be around 25 minutes. Now would be a good time to take a break if you need one before beginning the final section. Here we are, the speaking section. For many of you, this is the most nerve-wracking part of the test, but it's actually your best chance to show off your professional skills. If you're feeling a bit unclear about the speaking section and would like more guidance, check out the Understand OET Speaking in Just 16 Minutes video, or read our blog, OET Speaking. Both of these are linked in the notes below. The OET Speaking subtest consists of 2 role plays. You play your profession, whether that's a nurse, doctor, pharmacist, or anything else, and the interlocutor plays the patient or caregiver. Today, we're going to practice just one of these role plays. Whether you're heading to the UK, Australia, or the US, the format is the same. When you start, there's a warm-up where they ask about your career. This is not scored. It's just to help you relax. You'll be asked questions about your professional background, such as where you did your training, your specialization, why you chose your profession, and how long you've been working in healthcare. But the real test begins when they hand you the roleplay card. You have 3 minutes to prepare and 5 minutes to speak. Let's look at the 3-minute prep strategy. Those 3 minutes of preparation are the most valuable minutes in the test. Do not just look at the paper, you need to analyze it. The roleplay card clearly defines the parameters of the task. It details the setting, like your hospital or clinic workplace, and your role, such as nurse, doctor, or dentist. And crucially, it provides the specific context for the dialogue, such as you're speaking to a patient who is concerned about their medication. Let's look at our task for today. First, check the setting. For this roleplay, it's a suburban general practice. In North America, think of this as a family medicine clinic or a visit to a primary care physician. The tone is less urgent than the ER. Next, look at the patient. They're 56, have a family history of hypertension, and appear anxious. Note that anxious is a key word. You cannot just deliver medical facts. You must show empathy for their anxiety. If you ignore their anxiety, you will lose points for relationship building. This is a very important section, and even native English speakers lose points here if they aren't careful. Now, let's look at the tasks. The first task is to find out what is worrying the patient. In other words, you should start with open questions. Then you want to explore their history and lifestyle. Be sure to ask permission before diving into personal habits. Then you'll want to explain the tests needed. Be sure to manage their expectation and explain that you can't prescribe the medication yet. Next, encourage lifestyle changes, but be positive, not bossy. Next, you want to explain the importance of checking. This is safety netting. Now it's your turn. I want you to grab your phone and open the voice recorder app. I'm going to leave this card on the screen. We'll set a timer for 3 minutes so you can read it and plan your opening line. Then we'll set a timer for 5 minutes so you can record yourself speaking as if the patient is sitting right in front of you. Ready? Start now. Welcome back. How did that feel? Did you finish all of the points? Now let's listen to a student attempting this task, and then we'll grade them together.
The role play will last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Hi, Mrs. Smith. What brings you in today?
Hi, doctor. I've made this appointment because I'm very worried about my blood pressure.
I see. What exactly is that it's worrying you?
Well, we have a strong history of hypertension in my family.
I see. Have you had any recent symptoms of hypertension? For example, chest pain?
No.
That's good. What about headaches or confusion?
Not really, no.
And have you ever noticed blood in your urine or anything else out of the ordinary?
No, I don't think I've ever noticed that.
So you haven't had any clear symptoms?
No, but I'm really worried about it because of my family history.
Can you tell me more about that? Who in your family has blood pressure problems?
My father died of a stroke when he was 62.
I'm sorry.
And my younger brother has very high blood pressure, which he's currently taking medication for. So, I want to start taking medication to be on the safe side.
I understand why you're concerned, and you've done the right thing by coming in today to check this out. Now, I'd like to ask you a few questions about your lifestyle. First of all, do you smoke?
Yes, I do.
How much do you smoke? How many cigarettes a day?
About 20.
Do you drink alcohol?
Occasionally.
Okay, and what about your physical activity and diet? Do you exercise?
Not much. I don't really have the time for it.
And would you say your diet is healthy?
I don't think so, to be honest.
Right, okay. So you smoke regularly and occasionally drink alcohol, and your exercise levels and diet are somewhat limited. Is that right?
Yes. Honestly, I'm really scared. I really need to start taking medication, or I'm afraid I'm going to die.
I can see this is very frightening for you. So since you're not displaying any obvious symptoms, we will need to run a series of tests to see if there are any other signs of hypertension. For example, we'll check your blood pressure and we will need to take our urine sample, conduct some blood tests, and assess your kidney function. How does that sound?
It sounds good, but I don't want to have to wait for the test results in case something bad happens in the meantime. Can you just give me some medication to start taking right now?
I'm afraid I can't prescribe you any medication before seeing the test results. But that will only take a few days. That's not going to make your condition any worse. Does that make sense?
I'm just really afraid I might die if I don't start protecting myself. I'm sure that taking blood pressure medicine will be right for me, regardless of the test results. Can't you give me something now?
I'm sorry, that won't be possible. Taking medication without knowing exactly whether there is a need for it can do more harm than good. Do you understand?
Okay, we can wait. But is there anything else I can do now to reduce my risk?
Absolutely. Have you ever tried to quit smoking?
Not really. I imagine it would be very difficult after so many years.
I understand, but I can give you information about tools and support available so you can gradually reduce your smoking. Would you be willing to try?
Sure. I know it's not a healthy habit. Is there anything else I can do?
Regular exercise, such as walking for 30 minutes a day, would be a great help. And of course, following a healthier diet would be very important. There are various home meal delivery services. I could recommend some to help you with this. How does that sound?
Yeah, okay, I'll consider those. So, when can we discuss medication?
Let's make an appointment for next week. The test results should be ready by then, and we can explore appropriate options such as medication. And one more thing, I'd like you to have your blood pressure measured regularly. It's really important because of your family history. Let's keep an eye on it, alright?
Right.
Is there anything else I can help you with today?
Thank you. That's the end of the role play.
That was a solid performance, scoring a band B, roughly 350 to 400 points. It was good, but not perfect. Let's break it down by criteria to see how they could have hit in A. Let's look through the criteria. We'll start with relationship building, which is clinical indicator A. Here, they would have received a score of 4 out of 5. The student was professional, but the opening was a bit clinical. For indicator A1, initiating the interaction appropriately, they missed a chance to set a warm tone. The student said, "Hi, Mrs. Smith, what brings you in today?" But A better approach would be to say, "Hi, Mrs. Smith. It's good to see you again. I understand you've come in for a checkup." This is because in a GP setting, acknowledging a prior relationship builds rapport immediately. Regarding the lifestyle questions, the student's directness lacked indicator A2, demonstrating an attentive and respectful attitude. The student said, "Do you smoke? Do you drink alcohol? Do you exercise?" A better approach would be, "Would you mind if I asked a few questions about your lifestyle to get a better picture?" Asking for permission before asking sensitive questions is a key indicator of respect. For understanding the patient's perspective, clinical indicator B, the student would have received a score of 4 out of 5. The student acknowledged the anxiety but failed at indicator B2, picking up on the patient's cues. When the patient said, "I'm afraid I'm going to die," the student moved too quickly to medical tests. A higher scoring response requires indicator B1, exploring the patient's concerns. Instead of just saying, "I can see this is frightening," you should ask, "Can you tell me more about what's worrying you specifically?" This would likely reveal the fear surrounding her father's early death. Now let's look at providing structure, or clinical indicator C. This student would have received a score of 4.5 out of 5. The flow was logical, but the student could improve on indicator C2, signposting changes in topic. Instead of jumping to the next task, use indicator C3, organizing techniques. Try, "Thank you for sharing that. Now that we've discussed your lifestyle, I'd like to talk to you about the next steps, which involves some testing." This will provide a roadmap so the patient isn't lost during the transition. Let's move on to information giving, which is clinical indicator E. Here, the student would have scored a 3.5 out of 5. This was their weakest area. The explanations lacked indicator E1, which is establishing initially what the patient already knows. Remember, you never want to lecture. You should always ask something like, "What do you already know about high blood pressure?" before explaining it. Furthermore, for indicator E4, checking whether the patient has understood, the student relied too much on the phrase, "Do you understand?" To move from competent to adept, use indicator E3, encouraging the patient to contribute reactions. Try to mix it up. Ask, "How does that sound to you?" or "Does that make sense so far?" Now let's move on to linguistic resources. Here, the student would have scored a 4 out of 5. For appropriateness of language, the student scored well, but missed opportunities for lay terms. The linguistic level descriptor for Band 6 criteria says the student has no difficulty at all in explaining technical matters in lay terms. Here, the student used hypertension repeatedly. While this is accurate, a Band 6 or Grade A performer would use high blood pressure to ensure the patient understands and feels comfortable. So the key takeaway? Remember that you are speaking to a person, not a medical textbook. In summary, ensure you're using your soft skills, like empathy, which is A4, and asking for permission, A2. Include signposting. Tell them where the conversation is going, for C2. Use lay language. Avoid words like hypertension. Use high blood pressure instead, for appropriateness. If you want to practice with a real interlocutor and get a score on your performance, check out our one-on-one tutorials at e2language.com. Great job, everyone! That concludes our full OET mock test. That was a huge effort. You've worked through listening, reading, writing, and speaking. If you found this helpful, hit that subscribe button. Good luck with your preparation, and if you need more support, please reach out to us.